Well students, this is the module on affective skills, and let us first know what will be the learning outcomes of this module. So, after studying this module, you should be able to know what are the counseling skills, understand the different meanings of skills, learn about the meaning of affective skills, insight into the emotions and its components, analyze the emotions through affective skills of a therapist. Now, let us first introduce you to the topic. The success of any counseling or psychotherapy session depends considerably on the skills of a counselor. These skills help facilitate a good rapport between the therapist and the client and helps gain an understanding of the process between the two. The term skills can be used in different connotations. One usage of the term skills means an area of skill such as listening or disclosing. Another meaning and use can be to refer to the competency level, such as how good or strong one is in a particular area. Hence, one may have degrees of competency in a skill. One may be stronger in a different area, such as active listening, but not good in summarizing. Another meaning of the term skill relates to the knowledge and decisions required in implementing a skill. This aims at achieving the counseling objectives. For instance, if you are able to be a good listener, the choices and decisions need to be made in this skills area. The aim of the counseling skills training programs is to help learn how to make strong and effective choices. The therapeutic competence of a counselor is a resultant of his self-awareness, his knowledge of therapies and the application of skills. The personal component that the therapist brings is reflected in self-awareness. The education and training of a counselor comprises his knowledge. The skills of a counselor helps him use his awareness and knowledge into effective therapy. Hence, for effective therapy and counseling, all these aspects need to be used. Nelson and Jones 2005 describes counseling process through a life skills counseling model. It is a 3-stage model, and the first stage is called as the relating stage. In this stage, the main task of the counselor is to form a collaborative working relationship with the client. This stage comprises of 3 phases. Phase 1 is pre-counseling contact, which involves communicating with the client and providing him information prior to the first session. The second phase in this stage is starting with the initial session. This involves meeting, greeting and seating the client. Also, it involves making opening remarks and encouraging clients to tell why they have come. The third phase is facilitating client disclosure, which involves allowing clients the space to reveal more about themselves and their problems from their own perspective. The second stage is the understanding stage. In this stage, the main task is to assess and agree on a shared analysis of the problem. This too has 3 phases. Phase 1 is the reconnaissance phase, which involves conducting a broad review to identify the client's main problems and to collect information to understand him or her better. The phase 2 involves detecting and deciding, that is, collecting specific evidence to test ideas about possible poor skills and then reviewing all available information to suggest which skills might require improvement. Phase 3 is agreeing on a shared analysis of the client's problem. This involves arriving at preliminary analysis of the client's problems, including where appropriate, specifying the mind skills and communication and action skills for improvement. The third stage is the changing stage. In this stage, the main task is to achieve client change and help in maintenance of change. This stage has 3 phases. Phase 1 consists of intervening, which involves helping clients develop and implement strategies for managing current problems and improving relevant mind skills and communication or action skills for now and later. Phase 2 consists of ending, which involves assisting clients both to consolidate their skills for afterwards and to plan how to maintain them when counseling ends. The third phase is client self-helping, in which the main task is of the client to keep using their skills, monitoring their progress, correcting lapses and where possible integrating their improved skills into daily living. Now let us come to an understanding of what are affective skills. The counselor uses affective, behavioral and cognitive skills simultaneously to develop a meaningful rapport with the client and make the therapeutic process effective. The term affect implies to the relative or momentary mood of the client. In usual language, we refer to it as feeling. As living beings, we constantly feel, and this in turn affects our thoughts and cognitions. It is believed that we are shaped by our feelings. Some common and significant feelings include happiness, interest, surprise, fear, sadness, anger, disgust or contempt. The dictionary definition of feelings tend to use words like physical sensation, emotions and awareness. These are various dimensions of feelings. Feelings as physical sensations or as physical reactions represent people's underlying instinctual nature and the fact that feelings are resultant of physical changes in body such as hormone secretion and nervous system stimulation. Examples of primary emotions is sadness, anger, happiness, shame, and examples of physical sensations include headaches, muscle tension, chills, etc. The word emotions implies movement such as the continuous flow of biological experiencing. Awareness implies that people can be conscious or make a cognitive assessment of their feelings. The feelings and physical reactions experienced during negative or stressful events cause immense uncomfortableness and difficulties for a person. Feelings have various dimensions such as feelings can be overt or covert or a combination of two. Overt feelings are evident in verbal and non-verbal cues. Covert feelings are hidden such as a person experiencing anxiety in his first public lecture. Feelings can be positive, negative or neutral. Emotions like happiness, love, etc. are positive. Worry, anger, sadness are negative. Others such as drowsiness and inquisitiveness are neutral. Also, the intensity of emotions vary greatly depending on the person and the circumstances. People may be aware or unaware of their emotions and sensations. Appropriateness of feelings is also a significant dimension affecting how we are perceived by others and our relationships with them. Also, congruence is very important. When feelings expressed verbally and non-verbally have the same message, they are said to be congruent. Incongruent emotions are when the verbal expression is different from the non-verbal felt emotion. Congruence also helps in sending clear and compact messages. Emotions tend to help or hurt people on the basis of various factors discussed above. Expressing emotions can enhance our relationship and help us move towards positive achievement. Expressing emotions can harm our personal relationships with others also. Emotions are also affected by gender. Women are more attuned to reading emotions in others. In addition, women easily express emotions as compared to men who fear expression. Some research has also suggested that older adults experience less anxiety and depression, more contentment and shorter period of negative mood than younger adults. Emotions are also expressed differently in different cultures. Only emotions that are compatible with a particular culture are expressed by people belonging to that culture. Hence, assessment of the feeling and physical reactions is significant for the counseling process. The counselor needs to be competent enough to be aware of his or her own feelings as well as clients. Feelings need to be experienced, expressed and appropriately managed. All these refer to the affective skills of a counselor. Now let us understand how the counselor deals with affect and emotion in a counseling session. Emotion and feelings are complex in nature. Emotions comprises of three aspects: emotional awareness, emotional experience and emotional expression. Emotional awareness refers to becoming conscious and identifying the feelings present in a person. Emotional experience refers to the ability to recognize the bodily sensations and changes in the body accompanied during an emotion. Emotional awareness and experience help in understanding of affect and identification of target emotions that need to be changed. Emotional expression is the outward manifestation of the inner physical changes and feelings experienced. These three aspects of emotions are closely linked with each other. Now let us understand the process of affective awareness. The counselor first focuses on the affective awareness of the client. This is usually assessed through detailed questioning and discussions with the client. The focus is to explore the feeling of the client. Also, some strategies used are helping the client become aware of the physiological changes linked to the feelings, such as bodily awareness exercises, breathing exercises, etc. Hence, the client learns to listen to the signals produced by the body. Next, the client is told to enlist or tell the inner experiences that he has of affect or feeling, such as growling of stomach, pain in abdomen, headache, stiffness in neck, sweating, palpitations, breathlessness, etc. Next, the client labels his feeling, such as sad, anxious, stressed, anger, depression, etc. Now the client is taught to identify the intensity of the affect. This is important as it indicates the subjective perception of the distress caused by the affect. Also, it will help identify which emotions cause more distress and target these emotions first for change. Sometimes there may be mixed affect and conflicting affect experienced simultaneously. This may lead to confusion and failure in identifying the emotion. Confusion may also be due to lack of acceptance of the emotion. The counselor then identifies the underlying affect for the client and works towards the acceptance of the affect. The client is taught how certain affective and response styles may have developed over time. Understanding affect helps client gain confidence to manage one's emotions. Now let us go on to the procedure of how understanding of affective expression is done by the counselor. Expression is explored and assessed to understand the potential areas for intervention. The counselor tries to understand whether the expression of emotions outwardly is equivalently appropriate and congruent to the inner feelings. The congruency and intensity both are assessed as problems may occur if expression is not congruent and if not at the same intensity as felt. Outward expression is also significant. If there is no outward expression, then the reason for this needs to be found, as this may be the result of extensive defensive mechanisms employed by the client, which is unhealthy. Let us now understand the role of catharsis in counseling sessions. Catharsis simply implies facilitation of emotion. It is the process of outward expression of the inner felt affect. Catharsis is significant for working with affect of the client. It helps the client to identify and accept one's affect. It raises inner self-awareness of the client and helps him take responsibility of his affect as it is done in the safe setting of counseling. Now let us see what is the work being done on body and affect by the counselor. The client needs to realize that there is an integration between the mind and the body. There are various exercises that the client is taught to understand about the fine balance between body and experience of affect. These exercises focus on smaller muscle groups and gradually focus on overall body. Another relaxation technique called as Jacobson's progressive muscle relaxation technique is also used. In the Indian context, Hatha Yoga prescribes breathing exercises such as Anulom Vilom and meditation. The various stages of these exercises are linked to how feelings lead to tension and relaxation of various muscles. This helps the client to gain control and manage their affect and not become victims of their emotions. Now let us come to the understanding of dealing with affect and emotion. The focus here is on helping clients become polished with their affective experience, teaching them higher levels of affective awareness. It helps the client accept all of their emotions and recognize their meaning and source. Exploring the affect, the client needs to learn and become aware of their inner experience and recognize the emotion felt. The client needs to recognize their emotional state empathically and accurately. Some clients are unable to recognize their affect because of some possible reasons such as childhood learning of not paying attention, traumatic experience leading to repression, poor environment in childhood, excessive focus on cognition and behavior, and failure to learn expression and labeling of affect appropriately. Some general affective strategies used by clinicians, especially humanists, are imagining the worst that might happen, providing emotionally powerful stories, metaphors, etc., using emotionally charged language, persuading, eliciting appropriate emotions via imagery, and then practicing changing them, using humor, encouraging willpower and determination to change, and promoting unconditional clinician.